Have you noticed your ankles looking a bit puffy lately? Maybe your socks are leaving much deeper marks than they used to at the end of the day? It's easy to think it's just part of getting older, something that happens after 70. But please, listen closely. That seemingly small change, that persistent swelling in your legs, is something you should never, ever ignore. It could be your body sending a quiet but urgent message about your heart health. Dismissing this sign, maybe blaming it on standing too long or a salty meal, could mean missing an early warning for a serious condition like heart failure. Catching it early is so important. Ignoring it can delay getting the help you need and potentially lead to more significant health issues down the road. So, in this video we're going to talk clearly and simply about this specific leg sign. We'll help you understand exactly what to look for, explain why your legs might swell when your heart is involved, and crucially help you figure out when leg swelling needs immediate attention versus when it might be something less serious. We'll also outline the exact steps you should take if you notice this sign. Our aim today is to give you clear, reliable information so you can be more aware of your body's signals and take confident steps for your health. As we journey through our later years, our bodies do change. That's perfectly normal. Maybe aches pop up more often or energy isn't quite what it used to be. And yes, sometimes legs can feel heavy or get a little swollen. It's understandable to link these things to age. But the key is paying close attention to changes that are new, persistent, or getting worse, especially when it comes to our heart. Having trustworthy health information is vital. And recognizing potential warning signs early is a powerful way to stay proactive. Many doctors and heart specialists stress the importance of noticing symptoms like unexplained leg swelling. Why? Because finding conditions like heart failure early often means it can be managed much more effectively, helping you maintain your independence and quality of life. Real-world experience and health guidelines show us time and again that symptoms sometimes brushed off as minor can be the first clues to underlying issues that truly benefit from prompt medical care. So let's walk through this together. We'll start by clearly describing this specific leg swelling, what it looks and feels like so you know precisely what we mean. Then we'll uncover the link between this leg sign and your heart, explaining in simple terms how a heart issue can show up in your legs. Since not all swelling is serious, we'll also discuss other common reasons your legs might swell, giving you a balanced perspective. After that, we will point out the important red flags, other symptoms that, if they appear alongside leg swelling, signal you need to seek medical advice right away. And finally, we'll lay out the practical, clear steps you should take if you recognize this persistent swelling in yourself. By the time we finish, you'll have a much better understanding of this important health signal and feel more prepared to act if needed. Let's begin by getting a clear picture of the sign we're discussing. The medical name for this kind of swelling is edema. Edema simply means swelling caused by extra fluid getting trapped in your body's tissues. When this happens in your feet, ankles, and lower legs, it's sometimes called peripheral edema, but we can just think of it as leg swelling. What makes it seem subtle, especially at first? Well, it might creep up slowly. You might just feel your shoes getting tight by evening. Or maybe, when you take off your socks, you see those elastic marks are deeper or they stick around for longer than they used to. It might not hurt at first, just a sense of fullness or heaviness down there. A key thing to notice, especially if it relates to the heart, is that the swelling often happens in both legs around the same amount. Swelling in just one leg usually points to something different, maybe a local injury or even a blood clot, which also needs checking out but has different causes. Now here's something specific to look for: pitting edema. Try this. Gently press your thumb or finger into the swollen spot for about 5 seconds. When you lift your finger, does it leave a little dent or pit that stays there for a few moments before slowly filling back in? That's pitting. It happens because you're pushing that trapped fluid aside temporarily. If the tissue feels firm and doesn't really indent, that's non-pitting edema, often linked to other things like lymphatic issues. So, noticing if the swelling pits is helpful information for your doctor. Where does this swelling usually show up first? Gravity plays a big role. So, you'll often see it in the lowest parts of your body, especially after you've been sitting or standing for a while. This means you might notice it in your feet, making shoes feel snug or feet look puffy on top. You might see it in your ankles, where the shape of your ankle bones might seem less defined. Or it could affect your lower legs with swelling gradually moving up your shins. It often feels worse towards the end of the day and might get a bit better overnight when you're lying down, as the fluid can shift around. But if the underlying issue isn't addressed, the swelling tends to become more constant or keep coming back. Why is it so easy to overlook? Because we do sometimes get mild swelling from heat, long car rides, or standing around. Some medicines cause it too. So it's tempting to ignore it. But please focus on swelling that is new, doesn't go away easily, seems to be getting worse, affects both legs, and especially if it has that pitting quality. That's the subtle sign we need to pay attention to, particularly after 70. Knowing what it looks like is the first important step. Now let's explore why your heart might cause leg swelling. You've noticed this pitting swelling in both legs. How on earth could that be connected to your heart, way up in your chest? Let's connect the dots simply. Think of your heart as a hard-working pump. Its vital job is pushing blood all around your body, delivering oxygen and nutrients everywhere, and then bringing the used blood back to get refreshed with oxygen in the lungs. Heart failure sounds scary, but it usually doesn't mean your heart has just stopped. More often, it means the heart muscle has weakened over time or become stiff, so it can't pump blood quite as strongly or efficiently as it needs to. This happens more often as we get older, sometimes due to long-term health issues like high blood pressure that wasn't fully controlled, damage from past heart attacks, blocked arteries, or problems with the heart valves. So, what happens when this pump isn't working at full capacity? Well, one thing is a sort of traffic jam effect. Imagine the right side of your heart receives blood coming back from your body. If it's not pumping strongly enough to push that blood forward into the lungs efficiently, the blood starts to back up in the veins leading to the heart. Like traffic backing up trying to get into a busy city. This backup increases pressure inside those veins, especially in your legs and abdomen because they are furthest away and fighting gravity. Another consequence is that fluid leaks out. This higher pressure inside the veins acts like squeezing a leaky hose. It forces some of the watery part of the blood to seep out through the walls of the tiniest blood vessels, the capillaries, and into the surrounding tissues. Gravity naturally pulls this escaped fluid downwards, making it collect in your feet, ankles, and lower legs when you're mostly upright. That collection of fluid is what you see and feel as swelling or edema. There's also a response from the kidneys. When the heart pumps less blood, your kidneys might notice the reduced flow. Thinking the body needs more fluid volume, they might try to help by holding on to more salt and water instead of filtering it out. Unfortunately, in heart failure, this just adds more fluid to a system that's already struggling to handle what it has, making the swelling worse. This whole situation, the fluid buildup causing swelling in the body, and sometimes shortness of breath if it backs up into the lungs, is often called congestive heart failure. The leg edema is a classic outward sign of this internal fluid overload caused by the heart's difficulty pumping. Sometimes, problems starting on the left side of the heart can eventually strain the right side too, leading to edema after other symptoms like breathlessness might have appeared. So, that persistent, pitting swelling in both lower legs isn't just random puffiness. It can be a direct result of your heart finding it harder to do its job. The fluid building up is a physical sign of that struggle. Understanding this connection shows why this seemingly simple leg sign is so important to investigate as a potential clue about your heart's health. It's not the only possibility, of course, but it's a critical one not to ignore. Moving on, it's really important to know that swollen legs do not automatically equal heart failure. Many other things can cause edema, some quite common and less worrying. Knowing these helps keep things in perspective and highlights why seeing a doctor for the right diagnosis is essential. For example, vein problems, often called venous insufficiency, are very common. This happens when tiny valves inside your leg veins weaken and don't push blood back up to the heart effectively, causing pooling and leakage. Clues for this might include swelling worsening through the day but improving with elevation, seeing varicose veins, having achy legs, or noticing brownish skin near the ankles. Kidney issues are another possibility. If kidneys aren't filtering properly, fluid can build up, often noticed in the legs and sometimes around the eyes. Other signs might include changes in urination, fatigue, or nausea. Simple tests can check for this. Liver problems can also play a role. A diseased liver might not produce enough albumin, a protein that keeps fluid in blood vessels, leading to leakage and swelling in the legs or belly. This usually comes with other signs like jaundice or easy bruising. Medication side effects are also frequent culprits. Many common drugs, including some for blood pressure like amlodipine, anti-inflammatories like ibuprofen, certain diabetes pills, hormones, steroids, and even some antidepressants can cause leg swelling. If swelling started after a new medicine, that's a key clue to discuss with your doctor. but never stop medication without their advice. Being still for too long, like on trips or due to limited mobility, can cause temporary swelling as gravity pulls fluid down. This usually resolves with movement. Eating too much salt can also make your body retain water and contribute to swelling. Less commonly, problems with the lymph system, called lymphedema, can cause swelling, often in just one limb and feeling firmer. And a blood clot, or DVT, is a serious cause usually presenting with swelling, pain, redness, and warmth in only one leg, requiring urgent attention. Knowing these other possibilities isn't meant for self-diagnosis. It's to show that leg swelling has many potential routes. While heart failure is a critical one to check for, only a doctor, after looking at your whole picture, can find the real cause. This helps avoid needless worry while still stressing the importance of getting persistent swelling checked out. Now let's talk about when swelling is more concerning. When should you be especially concerned that the swelling might signal heart failure or another serious problem needing quick action? Be alert if the leg swelling comes with any other significant symptoms. Think of these as red flags. One red flag is a sudden start or rapid worsening of the swelling. If it appears over just a day or two or gets much worse quickly, that's more alarming than gradual, stable puffiness. Another major red flag is shortness of breath. This could mean getting winded with simple activities, feeling unable to breathe well when lying flat in bed and needing pillows to prop yourself up, or even waking up suddenly at night gasping for breath or coughing. An ongoing cough or wheezing, especially if worse when lying down or producing frothy phlegm, can also be linked to fluid backing up into the lungs from the heart. Feeling unusually tired or weak, experiencing extreme fatigue that doesn't improve with rest, is another sign, as your body might not be getting enough oxygen-rich blood. Also watch for quick weight gain. Gaining several pounds in just a day or two, or maybe 5 pounds in a week without changing your diet, often signals rapid fluid retention. Pay attention if the swelling starts moving higher up your legs towards your thighs, or if you notice swelling in your belly, hands, or face too, as this suggests more widespread fluid overload. And crucially, any chest pain or discomfort accompanying the leg swelling needs immediate medical help, as it could indicate a heart attack or severe heart strain. Finally, in some severe cases, confusion or fuzzy thinking can occur due to reduced blood flow or chemical changes. If you have leg swelling plus one or more of these red flags, especially breathlessness, rapid weight gain, or trouble breathing lying down, please seek medical attention promptly. Don't wait and see. Call your doctor right away, or if symptoms are severe, call emergency services or go to the emergency room. These signs strongly suggest something significant is happening that needs immediate evaluation. Recognizing them helps you act fast for your health. So, what should you actually do if you've noticed that persistent pitting edema in both legs, perhaps even with some of those red flags? Here's a clear plan. First, and most importantly, do not ignore it. Resist the urge to brush off ongoing or worsening leg swelling. Because of the potential link to serious conditions, it always deserves to be checked out by a professional. Finding the cause early almost always leads to better management and health outcomes. Second, make a doctor's appointment. This is essential. Call your regular doctor or clinic. Tell them clearly why you're calling. Mention the leg swelling, describe it, say when it started, if it's changing, and list any other symptoms you have, like shortness of breath or fatigue. Being specific helps them understand the situation. Remember, if your symptoms feel severe or came on suddenly, especially serious shortness of breath or chest pain, don't wait for an appointment. Call for emergency help immediately. Third, get ready for your visit. Help your doctor by thinking about when the swelling started, if it's in one leg or both, if anything makes it better or worse, if it pits when pressed, and if you've had recent weight gain or other symptoms like breathlessness. Also, make a complete list of all medications you take, prescriptions, over-the-counter items, vitamins, supplements, and bring it with you. Remind them of your existing health conditions too. Fourth, understand the test your doctor might suggest. They'll examine you carefully, listen to your heart and lungs, and take your vitals. To find the cause, they might suggest blood tests to check kidney, liver, and thyroid function, or heart strain markers. A urine test might also be needed for kidney assessment. An ECG or EKG checks the heart's electrical activity. A key test called an echocardiogram, an ultrasound of the heart, shows how well it's pumping. A chest X-ray can reveal heart size and lung fluid. Other tests, like an ultrasound of leg veins, might be done if a clot or vein issue is suspected. Fifth, discuss supportive lifestyle measures, but only under your doctor's guidance. While waiting for tests or as part of treatment, your doctor might suggest things like elevating your legs above heart level when resting to help fluid drain. They might advise watching your salt intake by limiting processed foods and not adding extra salt. Moving more, if appropriate for you, by avoiding long periods of sitting or standing still and doing simple foot exercises, can help circulation. Compression stockings might be recommended, but only if your doctor says they are right for your specific situation and ensures proper fitting. Sometimes, particularly with diagnosed heart failure, your doctor might ask you to limit daily fluid intake, and it's crucial to follow their exact instructions. Remember, these lifestyle steps support management but don't fix the root problem. The priority is the medical evaluation to find the why. Just a couple of quick, important points before we wrap up. First, sometimes leg swelling can have more than one cause working together. Someone might have both vein problems and early heart failure, for instance. This just reinforces why seeing a doctor for a full assessment is so important to get the complete picture. Second, if it does turn out that your leg swelling is related to heart failure, please know that while it's a serious condition, it is often very manageable today. It's a chronic condition, meaning it needs ongoing care, but with the right treatments and lifestyle adjustments, many people with heart failure continue to live active and meaningful lives for a long time. Treatments have improved greatly. Finding it early gives you the best chance for effective management. So, the goal here isn't to cause alarm, but to encourage awareness and timely action. We've talked through a lot today about paying attention to leg swelling after 70. Let's quickly summarize the most important takeaways. Remember to watch for ongoing swelling in both lower legs, especially if it leaves a temporary dent when pressed. That's pitting edema. Understand that while this can signal heart failure due to fluid backup, other causes like vein, kidney, or liver issues or medications are also possible, making a doctor's diagnosis essential. Be especially alert if the swelling comes with red flags like shortness of breath, sudden weight gain, ongoing cough, unusual fatigue, or chest pain. These need prompt medical attention. And critically, never ignore persistent swelling. See your doctor, describe your symptoms clearly, and follow through with their evaluation and advice. The main message is straightforward: your body sends signals. Persistent leg swelling is one worth listening to. Being informed empowers you to be your own best health advocate. We truly hope this discussion has provided you with clear and useful information. Understanding these potential health signs is such an important part of navigating our health journey as we age. If this video was helpful to you, please take a moment to click the like button below. It helps others find this information too. And if you enjoy clear, practical health advice for seniors, consider subscribing to our channel and ringing the notification bell so you stay updated with our new videos. Do you know someone else, maybe a friend or family member over 60, who could benefit from hearing this? Please feel free to share the video link with them. Sharing reliable information is a great way we can look out for each other. We'd also appreciate hearing from you in the comments. Did this topic resonate with you? Do you have questions? Or, tell us, what other health subjects relevant to seniors would you like us to explore in upcoming videos? Your input guides our content. Remember, paying attention to your body, noticing changes, and seeking timely advice from your doctor are powerful actions you can take for your health. Small steps taken consistently really do add up to make a big difference in your well-being. Stay informed, stay proactive, and take good care.